Imagine a world where a simple cough could change your life forever. This is the story of COVID-19, a virus that brought the world to its knees. COVID-19, also known as the coronavirus, is a contagious disease caused by the SARS-CoV-2 virus. The first known case was identified in Wuhan, China, in December 2019, marking the beginning of a global pandemic. Scientists believe the virus entered human populations through natural zoonosis, similar to previous outbreaks like SARS and MERS. Social and environmental factors, including climate change and wildlife trade, increased the likelihood of this zoonotic spillover. COVID-19 symptoms vary widely, often including fever, fatigue, cough, and loss of smell and taste. Symptoms can appear 1 to 14 days after exposure, with at least a third of infected individuals showing no noticeable symptoms. Of those who develop symptoms, most experience mild to moderate illness, but some face severe or critical conditions. Older adults and those with underlying health conditions are at higher risk of severe complications and death. Some people continue to experience long-term effects, known as long COVID, which can last for months or even years. COVID-19 spreads primarily through respiratory droplets when an infected person breathes, talks, coughs, or sneezes. Small airborne particles can remain suspended in the air, especially indoors, increasing the risk of transmission. Touching contaminated surfaces and then touching the face can also lead to infection. Testing for COVID-19 includes RT-PCR, rapid antigen tests, and CORT scans to detect the virus. Several vaccines have been developed and distributed worldwide, significantly reducing the spread and severity of the disease. Preventive measures include vaccination, wearing face masks, social distancing, and frequent hand washing. Despite these efforts, the virus has caused over 7 million reported deaths and an estimated 18 to 33 million deaths globally. The virus has evolved into multiple variants, with the Omicron variant becoming dominant in late 2021. COVID-19 can cause severe complications like pneumonia, acute respiratory distress syndrome, and multi-organ failure. Cardiovascular issues, including heart failure and thrombosis, have been observed in severe cases. Neurological symptoms, such as loss of smell and taste, seizures, and stroke, have also been reported. Pregnant women are at increased risk of severe illness, which can lead to complications like premature delivery. Fungal infections have been recorded in patients recovering from COVID-19, adding to the complexity of treatment. The virus primarily targets the respiratory system but can affect multiple organs, including the heart and kidneys. The immune response to COVID-19 can sometimes lead to a cytokine storm, causing severe inflammation and damage. Treatment for COVID-19 includes supportive care, oxygen therapy, and medications like dexamethasone for severe cases. Experimental treatments and antiviral drugs are being studied to improve outcomes for COVID-19 patients. The pandemic has highlighted the importance of global cooperation in public health and scientific research. Misinformation and disinformation have spread rapidly, complicating efforts to control the virus. COVID-19 has also affected animals, with cases reported in pets, zoo animals, and farmed mink. Research continues to understand the long-term effects of COVID-19 and develop more effective treatments and vaccines. Stay informed, stay safe, and remember, together we can overcome this pandemic. Keep watching for more updates and insights.